name is Charles Nderito. I'm a clinician at Greensteds International School. I run the school's medical center together with a nurse and support staff. It is a 24-hour facility which we run just to make sure that our students are covered in case of any eventualities, that we are available just to offer the medical care. Our main mandate is primary health care. That means assessing, triaging, and treatment of normal or common illnesses. We also do referrals and linkages because we have partnered with most of the main hospitals in Nakuru town, specialists and laboratories, just to make sure that in case we need maybe referral for any services that we don't offer in the sanatorium, that our students are able to access these services. Our core mandate first is to make sure that the medical standards are observed in the school, that we are able to follow up, that our staff, our students are always observing the right medical standards and maintaining the right medical standards while in school. We also do follow up for students who are on medication. When it comes to COVID specifically, we had a lead role in drafting what we are calling the GIS COVID guidelines, which is in line with the government protocols. We were able to make sure that it's done as per the accepted medical standards. We also do training for staff and students just to make sure that all the guidelines are followed and what is expected of each and everybody when they're in school. It is also our core mandate to ensure that every department is supported and guided when it comes to following the COVID protocols, when it comes to mask and anything that they require while in school, so that we make sure that especially the prevention part of COVID is followed. We do screening for every person in school, especially the points of entry. In the morning when our students are coming in the buses, we make sure that temperature checks are done and their records are done, and we keep them in the sanatorium. We also make sure that students who are brought in by parents, by the time they're coming to class, they first of all have their temperatures taken and recorded, so that we are able to pick anything that is alarming early enough. For those of us who are boarders, our students who are in the dorms, we have trained the matrons and the dorm parents to be able to assess them. Temperatures are taken in the morning and evenings and recorded for our records purposes in the sanatorium, so that we're able to identify any suspects for COVID or any other illness early enough. We have also trained our teachers, class teachers specifically, and our dorm parents again, to be able to identify students who may be having challenges health-wise or medically, that they are able to send them early enough to the sanatorium, where we now do the actual triaging and assessment. We have a scorecard for our students, those who are having flu-like symptoms, respiratory illnesses, to identify who may require further checkup, who may require tests, who may require to be referred for any services or for further follow-up. We have a scorecard that we use as a school that is guided by the Ministry of Health. As I said earlier, we've partnered with laboratories. Specifically for COVID, we are working with Lancet, which is one of the leading laboratories in Kenya. I believe it is first after the government institutions to be given the go-ahead to do COVID tests. We've been sending our students and staff for tests there. As a medical team, we have been trained on sample collection, and so we don't have to send our students out there for tests. We usually take samples from the sanatorium and then we send to the laboratory, and we get the results in 24 to 48 hours. Another thing we do when it comes to COVID is we organize for testing for students and staff who are traveling, especially those who are using flights. As you know, it's a requirement by the government that they all get tested 72 hours before the departure. But we have some countries that our students come from that require at least 48 hours. So we are able to link with our laboratories and also the parents to get the information about the requirements in their countries so that we're able to adhere to them. We do ensure and follow up that every person in school is aware of coronavirus and how it's spread and what we can do in our all different capacities to prevent the spread of it, and also to identify early enough in case there are any cases. And of importance, we emphasize on the 3 interventions that the government has been pushing for. One is social distancing, so we ensure these in all circles, in classrooms, in the dining hall, and also in every other space that the students and staff are in. We also emphasize on proper wearing of masks and the right masks to be precise. And we enforce and ensure that all students at all times are wearing their mask correctly, and staff as well once they're in school. We also ensure hand washing, and we are really grateful for the administration for providing the infrastructure. We've been able to put up more hand washing areas, and we emphasize mostly on use of soap and running water. But in some spaces we have the sanitizers just in case someone is not able to access water. In line with the government protocol, when it comes to management of COVID cases, we had to prepare as a school for any possible eventuality. The government guideline is that any COVID case that is confirmed is categorized into 3. One, we have the critically ill patients who require hospitalization and support in maybe ICU or HDU. We've organized with the hospitals around that our students are able to access that if need be. We'll also have cases or confirmed COVID patients who require treatment but don't necessarily require support. So for them, we also have identified hospitals that can be able to access that. And then we have those that require home-based care. For our students, we have a wide variety of students. We have students that come from within, day scholars mostly from Nakuru. We have boarders that come from around Nakuru and in Kenya. And then we also have those who come from abroad. So we have to prepare for home-based care even for those that come from far. So as a school, we've been able to set aside quarantine and isolation areas. Isolation areas is for the confirmed cases. Every student or staff that has been tested and confirmed to have COVID will require to be isolated and treated for at least 10 to 14 days. So we've set aside areas for that. Lastly, let's keep remembering that COVID is still here with us. Let us not relent, let us not relax. We still keep encouraging that all of us, everybody has a stake, and everybody needs to put in the effort to make sure that as a school we are all safe. For the students, we continue encouraging that you wear your masks at all times and wear them correctly. We will ensure that you wash your hands and keep social distance. But above all, as a medical department, we encourage that you feel free to come and consult anytime that you're feeling unwell or have any questions medically. Our staff, and especially our matrons and dorm parents and our teachers, we request that you have a high index of suspicion, that you're able to identify students who may be having challenges in class or may be feeling unwell and link them to us as we've always done. And to the parents, I request that we continue being the good role models. Let us talk to our children, let us understand it is a challenging time. Some of them need psychological support. Let us still continue instilling in them the need and the importance of still observing the COVID protocols. Let us be good role models. And especially to the day scholar parents, we request that we may continue providing the masks that we've been providing for the children, ensuring that they have at least an extra mask in the bag in case one gets torn, lost, or dirty. And also identify when your child is not able to come to school because of sickness. We encourage that any sick child should not be allowed to come to school. So we still encourage parents that if your child is unwell, kindly let him stay at home, let him be checked. And when they come back, that as a school, we're able to have a report of what their being treated for. We usually file that in the medical department just for the purpose of follow-up. We urge all of you to continue maintaining and observing the COVID protocols of importance, as we said earlier, social distancing, a proper wearing of masks and the right masks, and also hand washing. Thank you very much.